into how we're going to make those decisions. And what I mean by that is we're going to have people that just are uncomfortable coming back in person. We're going to have people that have their own health concerns and, you know, it's recommended they don't come back in person. We're going to have people that might be over the age of 65 that are concerned. So you can imagine we're going to have all kinds of scenarios. The other thing is we're also, our teaching force right now is about 50% professional services contract. That means they have property rights to their position different than those teachers that are annual teachers. So what will happen is we're going to come up with a process working with our union to say, okay, if I have more teachers that want to work from home, I have students to teach them, then how is that going to work? And so we're going to have to, again, it's going to be like putting a puzzle together and trying to figure that out. And we really just don't know when the rubber hits the road. People, you know, they're going to have to make the decision that is best for them and their, you know, their families and so forth. And we're going to provide for them. So if I choose not to come back, what are my options and what does that mean for me, you know, in terms of my career with the district, in terms of my finances. So that's sort of the project that we have ahead of us. And then of course, around all of that is we have to be cognizant of certifications because the state will not allow us to have teachers that may not be certified for a particular subject. You know, in other words, there may be some teachers that it doesn't match up. So we're going to have to figure out what we're going to do in those cases as well. I will tell you that as of, I don't want to say this was maybe 2 days ago, that our Leave Virtual count was up to about 7,000 families that are saying they might be interested in Leave Virtual. And the normal load is about 300 to 500 students. So that kind of gives you a comparison of where we're at. So we also will need some of these teachers to agree to take on those Leave Virtual positions that are going to be needed to meet the needs of those families as well. Any questions related to what I just shared?
I don't think it's a question. Clearly, it's a situation in flux.
Sure.
And, you know, I think a lot of the questions that we had preliminarily before the last meeting might have had to do more with a traditional type school year heading back to something normal. And then 15,000 a day of new cases kind of creates a difference in terms of what the planning might have been.
Well, and I will tell you that you know, when you look at what I consider the raw data that I talked to you about before, we really, looking at the numbers, are on par for hiring, you know, in the same as we have in the last 5 years. In other words, we're at the same number of openings. You know, this time last year we had 105 openings. This time we have 108 openings. So we're on par. But I got to tell you, I'm still a little concerned because when I match up the offers with the number of new teachers that have actually followed through, you know what I mean? Like done everything that they have to do to come on board, those numbers are not equivalent to what I had this time last year. So I think some folks are waiting to see what is the school district of Lee County doing? What are my options going to be before they finalize and actually, you know, come down here? We've also been experiencing, as some of you, you know, you'll probably really understand this due to the nature of your work, we have lenders that are being very, very persnickety. And so we have folks that are struggling to maybe to be able to come down here because they can't, you know, they put an offer on a house and they are doing everything they need to do, but they can't get, even though the district is writing the letter and saying, you know, this is, we have a job offer and here's what's happening. You know, it's not being accepted in some cases. So I got to tell you, there's a little, I definitely have a sense of concern relative to where we're going to land once we get that, you know, drop dead date to students coming back.
Well, Mr. Cohen.
Angela, I have a couple of questions. How are we going to handle it if a parent opts for
virtual learning, and then they realize that their child's not going to be able to handle it, and we start having those additional puzzle pieces during the course of the school year.
Yeah, and thank you, Paul. That is a really good one, and the one that I keep cautioning our unions about, that, you know, unfortunately, there will be a state of flux for our employees because we're going to have to respond to the changes. Now, as a general rule, we're saying parents will need to stay at Lee Virtual School for at least a semester. And for the Lee Home Connect, we're saying 9 weeks. But we also are not shutting the door because, you know, maybe they picked Lee Home Connect because they are unemployed and they get a job, and now, you know, they can't have their children at home. So we're going to be sensitive to those individual situations that we do have. But as a general rule, it's going to be 9 weeks, and then for Lee Home Connect, and then a semester for Lee Virtual School. And the same would be true if you are at the brick and mortar. Again, we want you to stay for at least 9 weeks, but we're also going to be sensitive to particular family situations.
And the other thing is, I saw that benefits is something that was discussed at the last board meeting. And how would the companies that are being considered handling what I'll call pre-existing conditions because of COVID?
That's not currently the way things are. That's not an issue for our employees. The guidelines, and, you know, because that has not been taken away relative to how our stuff is structured. So that will not be a concern either for people who are currently employed or who are coming on new.
Okay. And I had heard what you were saying about the lenders. I'm hearing the same thing in the marketplace. I think they're gonna have to explore just more favorable or more understanding lenders in the marketplace. There are still some that understand what's going on and the movement down. You know, the big banks that are not going to be as understanding about it. So unfortunately, it's going to require them to do a little bit more legwork.
Yeah, I agree.
I actually have a question. Angela, what happened when a student does get sick? I've heard rumors that they're isolated, and as far as I remember from my legal classes, that wasn't legal. And then on the other hand, you can get teachers that can end up being sick being around them. Has any of this really been negotiated with the unions? Because if a student gets sick, all the other students would need to be tested as well as the teacher ends up sick. Are they using sick time? Are we penalizing them? There's so many different angles on this that I'm actually concerned on, because A, as a parent, B, as a spouse of someone in the district, and C, looking at it going, this could really cripple the budget of the district if we make the wrong decision.
Yeah, and you raised some really good points there, Daryl, and I'll share with you what I know so far. We are still working through some of these decisions with our unions, but currently the way the plan stands is that if a child presents or an employee presents, there is an isolation room. However, when I say isolation, it's like a clinic that is only for COVID. Like, you know, suspected COVID. That's what we need by, the term is probably a little misleading, but it's to let parents know there'll be a clinic, like for the child that needs to take medication, the child that maybe just, you know, got a bump knee or whatever, but then there's going to be another clinic / isolation room that would be for students or staff with suspected COVID. And then we would take those steps. We are still working with the Department of Health to say, what do we mean by that? In other words, if we have a student that, let's say the student says, you know what, I'm not feeling well, and they present, and they're saying, you know, I have, and a child may not know, but let's say they present with 2 of the symptoms, then they would be sent to the quote unquote isolation room, and then an evaluation would be done in regard to that. Now, let's say that student then in turn tests positive and they notify the school. And what we're trying to determine is, and this is where, again, we're still working with the Department of Health, how does the contact tracing work? In other words, if we can determine that child only was around the students in that classroom And we can, and that's because they're saying right now they would go back 48 hours from the time that either you're known that you're positive or that symptoms present. They would do the contact tracing. The Department of Health would do that. They would notify, here's the people that then now need to quarantine. And is it going to be, is it a classroom? Is it a wing of the school? Is it, what is that going to be? So that's the one piece relative to those decisions, which have not, again, been finalized. The Department of Health is going to put together a team that is specific to the school district of Lee County, because as you can imagine, the timeliness of this information is going to be critical for us in order to stop the spread if we do, because we do anticipate there's going to be, situations that do arise, and we're going to have to be able to respond to those. So that's that piece. Now let me talk about the how that affects the employee. So there are two scenarios that we're talking through right now. There is the scenario that I'm an employee, I'm dedicated to the district, I come to work, I'm at the brick and mortar site, and now I'm being told I have to quarantine because a student or another employee say test positive, right? So, and that's directly related to being at work. So that's one scenario. And that's one that it's tough for me to say that's on the employee, because if not for being at work, that would not occur. So we're looking at what sort of a different type of leave that might work for those folks that are in that situation. That's very different than I went to the family picnic and my cousin tested positive, and so I was told by the Department of Health that I needed to contact, due to the contact tracing, that I needed to stay quarantined for 14 days. That's not directly related to your work at the school district, so that's a different scenario. Now, that being said, there are still situations where an employee might be eligible for the emergency paid sick leave, and or they might be even potentially eligible for the Family Medical Leave Act, depending on the specifics of their particular situation. But again, we're working through those and plan to have a specific COVID HR manual that we will have for all of our employees, so that they are very clear about if this, then this, and here's my options. Because what we don't want is employees being afraid because of the unknown, right? That's one of our biggest reasons people have fear, is because they don't know. And so we're going to do whatever we can to lay it all out in a manual so that everybody knows, here's the process, here's who I contact, here's my options. Because for me, it's really important that employees have some control, right, over what happens to them and how it happens. And I want to do my best to make them feel, that they have the information they need to make those choices.
Has there been an established contact person for students, families, and staff to address their concerns?
Yes.
For instance, my daughter, you know my daughter. She mentioned to me, she goes, well, if I go back to school and I get this in one classroom, I have 8 other classes I go to. Those teachers have 7 other classes. How is this going to work? Would she then go to virtual for one of the others while she's out? There's a lot of questions that stem just off of the one question.
Sure.
Students are nervous as well as parents and staff.
Right. And so let me address a couple of things regard to that. One is there will be a dedicated COVID hotline that will be manned by a task force that includes employees from each division in the district. That is going to be the place to call and ask your particular questions. Or what if you are an employee, or if you're a student and people, sorry, it's storming near me, and people are not doing what they're supposed to be doing. Let's say they're not social distancing, or they're not, doing what they're supposed to. You can call this hotline and report that, and then the task force will investigate that so that we can address that. The other thing is, if our plan would be that if a class quarantines, as long as the teacher isn't sick, then they would, like become a Lee Home Connect class, at least for, the 14 days of quarantine. Beeping.
Paul, I know you had some questions.
Yes, Angela, how many, and I don't know if this is something you can answer, has the district decided how many students will be a minimum number per classroom?
Not at this time, because it varies by classroom. So they're going to have to, that's one of the things that the schools are going to have to go in and figure out. And then when we know how many parents are willing to go in, for the brick and mortar, then we're going to match that up with the classrooms and the class size.
Okay, and feeding off of that, obviously that's going to play into the number of safety officers we may need for schools, bus drivers we're going to need to transport students to and from schools, specialty courses. I don't know how many, that's where it may get a little bit more challenging if you have the higher level classes or specialty classes. I don't know if we're really prepared to do a one-on-one where most of the students are opting for virtual and one student says, no, I'm a sight learner and I need to physically be in a classroom. So I think there could be some challenges there.
Yes,
And as far as employees go, what if a employee encounters or experiences a change in their health, whether it be suddenly they come down, unfortunately, with cancer, on a better note, they become pregnant, something where they had made an arrangement, they thought they could be in class, and now something has affected them health-wise.
Yeah, we will definitely work with those employees individually to figure out what we can do for them. I mean, our whole goal is to work with employees individually to meet their specific needs if we possibly can.
No, I understand that, but unfortunately, again, as you pointed out initially about the puzzle pieces, you have one teacher exiting because of one of those circumstances. Now we have to figure out an alternative to still provide that educational opportunity to the students who want to be in brick and mortar.
Yeah, again, we'll have some teachers who do not have students assigned to them that would be able to step in and do that in the brick and mortar environment. We're currently working on a plan for guest teachers and to train them and to have them ready to go. Because we know that, just like any other school year, people are going to get sick, things are going to come up, and we're going to need people that are going to come in and be able to do that.
And you led me to my last question for you. Are they going to be changing any requirements on guest teachers since it's so challenging to get them in the first place? And now with COVID being part of the mix, it's going to probably create even more of a challenge.
Yes, we're looking at all options right now. First, we have to get the preliminary number on our current guest teachers and how many are willing to work in the fall. And then we're going to go from there. And if we have that need, we would go to the board and make that request.
I appreciate it. Thank you.
Elena, you're up next.
Yeah, thank you. So if the student is removed from the class with suspected symptoms, obviously the parent, picks up and, have the child tested. Will it be parents' responsibility to share the results with the school, or will the Department of Health will notify the school independently of the test results?
We are going to ask that parents notify the school, but the Department of Health, that's part of their task force that will be with the district, they will notify us.
That's wonderful. And second,
we will send out a letter that will notify, it won't say who because of health privacy concerns, but it will say, your child has been exposed, we'll give you all the information.
so if you have a confirmed case in the certain class, what happens to the class?
My understanding right now is that the class would be quarantined, and if the teacher's not sick, they would teach virtually for those 14 days or the 2 weeks.
Okay, thank you.
Sean Williams.
So Angela, I don't want to be a pessimist, but it sounds like the Home Connect could be absolute chaos with kids coming in at 2-week intervals and leaving with 2-week intervals. I assume you guys are going through these scenarios and doing this planning to see how hectic that Lee Home Connect environment may be then.
Yes, in the normal circumstances, it's a 9-week switch, but we've got to account for, especially, you know, I mean, 92,000 students, we're going to have cases. And so we have to have some plan in place that is going to be least disruptive to families and employees. And so, you know, I agree with you. It's going to be challenging.
Sean Williams, you have something to say?
Yes, thank you, Mr. Chair. And thank you, Angela, for coming and sharing information with us. I want to build off of what Mr. Cohen had said earlier on substitutes and the guest teachers. The instructors, that's fine, but have we started thinking about a substitute support staff? I mean, we still need the buildings cleaned. And if someone tests positive, even in the support staff, it would affect our operations considerably. A bus driver wouldn't be picking up students. The custodial wouldn't be cleaning classrooms and the like. So do we have a plan for that as well?
Yeah, yes. And some of it involves the recruitment. And we do have, I'm going to be honest, it's not real robust. We do currently have, you know, substitute custodians and other substitute support staff. So, you know, but again, it's not that robust. So there's going to be some effort and there currently is an effort to try to work through that. We're also looking at and working with our union to see if we can cross-train and have people work outside their job description. You know, that might be potentially one option. You know, for example, your drivers are, you know, in the morning and afternoon. So maybe I'm short custodial help at a particular school. They could at least come in, or if they're short a food service worker, they could come in during that time between, you know, when they're don't have their regular runs. Same as people that work during the day, they might be able to provide custodial assistance at night. So yeah, we're looking at all of those relative to trying to figure it out.
Okay, and to build on that also, with a guest teacher, I know if I were a teacher and or a substitute and a teacher tested positive, I don't think I would, as a substitute, want to walk into that same classroom. I think it would be hard pressed to get someone in that same space to pick up where they left off.
I mean, I hear you. I would hope that, I mean, what they do when they come in and do this deep clean, I mean, it's amazing. But the other piece to it is, I know that schools are looking for other options due to that very thing. Like maybe they're not going to meet in that classroom. Maybe they're going to have to be in the media center, you know, for a couple of days or what have you, because the intent is that there won't be any large group gatherings. So things like the cafeteria during non-lunchtime, the gymnasium, the media center, those are all potential options where you could move a class to if you had, you know, that type of concern.
Okay, and have we looked at outdoor classing at all?
Sorry, yes, and outdoor classrooms as well. Thank you for that. I forgot about that.
Okay,
Yeah.
thanks.
Mm-hmm.
Thank you, Mr. Chair.
Angela, what about athletics and the arts programs like drama? And there's so many of them at some of these schools. How are those going to be affected? And how is that going to affect the system?
So, and again, I'm not, you're getting into an area now that I'm not the expert, but I'll tell you what I do know. And we can certainly get you the information in terms of specifics. At the elementary school, I know that those special teachers are going to be working, you know, with those other teachers and with the Home Connect teachers to provide things for the students to do, but not having large groups of students assigned to them. At the secondary level, the plan is, I believe, if the in-person, the brick and mortar, is to limit those in those special classes, and it may mean that they need more periods of that class. And that it also could mean that if there is a Lee Connect class associated with it, that those numbers would be higher because the teacher would have more periods in the brick and mortar because of lower class sizes than they would if they were Lee Home Connect. So, but I only know the broad strokes on that, Daryl. I haven't, my brain didn't have the capacity to retain that.
How is this affecting the district from a financial standpoint? It seems like there's so many more pieces going that this is going to be an astronomical expense.
I would say to you that I think Kelly would agree that yes, we have some very serious concerns about what the impact of this is all going to be.
Yeah.
Anybody?
It's even hard to try and figure it out because of all of the uncertainties. It's hard to even, identify how much things are going to cost us in different areas.
Sean, you had another question?
Angela, I had one more. I'm sorry, Sean.
All right. Yeah, sorry about that. The question I have is, I know that you have been intentionally looking for minority teachers. How has this pandemic affected those activities in trying to recruit more diverse workforce in the instructional staff?
Yeah, no differently than the workforce overall. The proof is going to be in when the final numbers come through. It's a little disappointing because we had our most robust recruitment plan this year relative to minority recruitment. And so I'm hoping that that it doesn't have too much of a negative impact, but I was really proud of the work that the team did, and the initial results and sort of offers that were extended and accepted. So I'll be able to report back to you, after October, what that specifically looked like.
Thank you.
Angela, just one last question. Different hat that I know that you wear. As far as insurance, with the kind of litigious world we're in right now, student comes into class, parent says they're healthy, they walk out of class and they have COVID. And are there insurance policies that are available out there for protection in the district?
Yeah, we've had those conversations, because you remember Bonnie McFarland that has come before you a few times. She does oversee that insurance as well for the district. There is not a set specific policy, but the advice that we have been given is that there's going to be, in regards to whether it's just general litigation or whether it has to do with workers' compensation, is that right now the advice that is being given by attorneys in that realm is that it is going to be the responsibility of in the example you gave, that student's family to prove that it is direct causal to the school district, and that the family would really have to prove that they have gone absolutely nowhere and been in contact with no one else in order for that really to happen. And the same thing with workers' compensation. An employee could say, well, but a student in my class had it, so that's how I got it. And workers' comp attorneys have advised us, well, then they'd have to prove that they don't go to the grocery store, that nobody else lives in their home that has gone anywhere, that they haven't been, so that's the current state of it. Now, I think we all know that, landscapes change and lenses change, but that is the advice and the conversation that we've been having so far.
Any other questions?
I have one. Daryl?
Yes, Mary.
Are there any special contracts that are going to be developed to take care of some of the unusual services that we usually don't do, like the deep cleaning and Are we going, or do we expect our current staff to take care of that?
Really, the answer to that is both. People don't really realize this, but we have deep cleaning protocols that we use during flu season. And we've sort of done that on steroids relative to the COVID response. And we have always worked with indoor air quality folks to come in and do that really deep cleaning because they're professionals and they have that equipment. We've also done a lot of things internally relative to our HVAC systems and the filters and all kinds of things that I really don't even understand, but have done some real things up front to try to mitigate some of that. But we are expecting that, I mean, I just can't imagine how if I were, still a teacher in the classroom, I certainly know that I'd have my little box of wipes and, and even if there was custodial staff coming in, I just probably my own, OCD, if you will, I would, want to do that myself. So I do anticipate that because we are, and Kelly can give you specifics, I think, on the supplies, the types of supplies that we have ordered that are going to be available to our employees. So, it is going to be, all hands on deck and trying to do this. And we don't know, we may have to, provide overtime, or we may need to hire on more staff if we see that, the brick and mortar and those students are a lot more than we anticipated. And so we have to, change things up, and back to the point earlier about the cost. I mean, we just don't know at this point, but we have our number one goal is to do the best that we can to create a safe environment for our students and for our employees, so that we can try to, to educate and move forward in the best way that we can.
Thank you.
Any further questions for Angela?
Yes, this is Joel Gordon. Maybe I missed this, but will there be any opportunities for families who do not wish to have their children in a brick and mortar to fully learn online, just as how they did?
Yeah, there's two options currently. One is Lee Virtual School. That one is very that's module based. In other words, the student, in my opinion, needs to be either have really direct parental involvement to help and make sure that the student is doing the work that needs to be done, or a very self-motivated student.
Mm-hmm.
Because the teacher is really there more as a resource and to grade the assignments and provide feedback.
Yeah.
So that's one option. The other one is the Lee Home Connect. And that is the option where we're going to do our very best to have the synchronous learning so that the teacher will be delivering instruction just as if they were delivering that instruction to the students in their classroom. And we know there's some challenges to that, but that is our intent going into that. And, so that would be more close to the in-class, environment. So those are the two options that we currently have available.
Okay, thank you.
Mm-hmm.
Angela, as far as teacher reviews, some teachers probably will excel in front of a classroom, may flounder with virtual learning or online learning. How are their evaluations going to be determined? Also, some students, their grades are going to lack. The parents are afraid to send them into the classroom. They may need to be in a classroom to really accelerate this study. And I know some of the components to a teacher evaluation is the scores of the students in the class.
Yes, and thank you for that. And there's two components to that. One is we're working closely with the state, and this is all districts. We are trying to see if we can get some kind of, waiver or something relative to the student scores, because the state has made it clear that they plan to continue with those state assessments, and they expect us to do so. So I would be advocating for mitigating what that means, not only for students, but also for staff. We will work with the evaluations are part of what is bargained with our unions, both our teacher and our support union. And so relative to the teachers, I would say on record that I would be advocating for what the terms we used starting a couple months ago, and that's grace and compassion, because I don't believe that it will be a level playing field, you know, relative to that. And so I'm going to advocate for whatever we can do to hold employees harmless.
Thank you, Angela, for coming to our meeting today. We really appreciate your time.
Yep. Anytime.
Thank you.
Thank you very much for all that you do.
Thank you very much. It was good to see you all. Take care.
Thank you. Be safe.
Bye.
Next on the agenda is the board member report. I'd like to welcome our newest member, Debbie Jordan, and she gets to give her first report.
Thank you. Well, first of all, I am Debbie Jordan, and it's a pleasure to be here. And I look forward to getting to know everyone. And actually, Angela just did a great job of giving the report. So I'm not sure if there's any other questions pertaining, because the only thing that we are continuously speaking about is the reopening of the school. And it is changing on a daily basis. So we're trying to keep our, our minds open and go with the, taking everything that we possibly can, answering a couple hundred emails a day from parents, teachers, students, because everybody does have great concerns regarding what is taking place. And then today, we went over the budget, which I know Kelly will be doing that with you all in just a minute or so. And just looking at those numbers, and we don't know, what it's going to cost. And I think the biggest thing, which I know Angela didn't state, is the fact of the testing. When we have no idea how long it takes for these testings to take place. Some of them are taking 5 days. Some of them may be taking 10 days to even get the results back. So that's another factor that we're, they're having to take into place on what does that actually look like, within the classroom or the teacher or just in general. I wish maybe we could possibly, have our own testing like a lot of other places do, and they get it back within a couple days. But right now we don't have that opportunity. But that's something I think that we should really think about doing. We have enough staff to make that happen. And then with today's meeting, speaking about what the costs are, related to what's going, and I'm looking at my notes, so excuse me, with, the equipment, the 10 to 15 million, which I believe they spoke about at the last meeting, if I recall, and per year just for equipment, and then for the defogging, $5,000 to $6,000, dollars to do that, which I asked today. I wanted to know what is the, is that per school? Is that like per square footage? What does that entail? So they'll get back with us regarding what that cost, the 5,000 to 6,000 would be to defog after someone is infected. And that's basically what I have. And just, we just, as I said, we just, every day it's a new day. Every hour it's a new hour. So we're just, going along and just trying to, do the best that we possibly can to get all the information, and appreciate everybody's work in what you all do, and just everybody. And that's pretty much my report for today.
I think Elena has the question.
Do you have a question?
Yes, I do have a question. Thank
Okay.
you. So I have a question about the actual school ratings that, usually released before this, during summer. So famous, A, B, C, D schools. So, and we know that if the school maintains or improves the ratings, the staff gets extra financial bonus, based on that. So is there with all this, fourth quarter, students being at home and, results being probably not as good as the school wanted, and with the new, school year, not really sure how that's gonna play. Is there a plan to possibly maybe freeze those ratings, or, not to evaluate school from, from those ABC stuff, so the teachers won't be so discouraged, and or everybody won't be so discouraged by those bad results potential is that would only be fueled by COVID.
Right. Well, as it stands right now, I know that we're in good standings. So we do not have any F schools. And after our last meeting with the FSBA and the chancellor, they're trying to do the best thing as well to kind of help the districts, work with us. So we're meeting with them on a regular basis to get the information, as well as the superintendent association, the attorneys. I mean, we have so many people working together because it's not just our district, it's all the districts. So, collectively, we're all basically having the same issues. We all had started off with the, a couple days of school, and then 3 days on, 2 days off. And then they came out with the 5 days that we had to do. So we had to switch it. And that happened to all the schools in the state of Florida. We, created the Lee Home Connect, where a lot of them have that same program, but they're calling it something else, whatever suits their, their area. But at this time, they have not given us like a leeway on that as far as the, the grading. It's just something that we're working, to see if they will assist us with that. We're constantly in contact.
It's just usually it might be potentially a big burden on principals and on staff on top of other things. So it might be, might be beneficial to discuss at least.
No, thank you. And I will definitely take that back to my, because I sit on the board of the FSBA. So I'm the representative for Lee County, and I will definitely bring that to our next meeting to actually have them advocate for that, which I'm sure we are already doing that, but maybe to have a bigger voice of more districts.
Thank you.
Welcome.
Sean Williams, you had a question?
Yeah, and I'm sure that we'll get into this probably in the budget discussion with Ms. Lecter, but I thought that the good school grading, the bonuses that were based on that were excluded from the final budget, the governor's budget. So we won't be receiving any monetary compensation, and the teachers won't be receiving bonuses based on school performance, I believe.
Is that right, Kelly?
Yeah, that is the, and if you want to, that can lead me into my presentation. If you if you don't have any other questions for Ms. Jordan, is that okay?
I have one question.
Thank
Well,
you.
actually, and you can actually reach out to me anytime. I'm available by phone, by email, however. Please, feel free to reach out to me. Daryl, you said you have a question?
I have a question. I woke up this morning, somebody sent me a message about the meeting with the Florida Department of Education, where the board did not give the Commissioner Cochran, I believe his name is, the go-ahead to insist brick and mortars were open 5 days. Has anybody been looking into that besides the governor's office? Because it's pretty clear when you listen to the video, they didn't give them permission. And that's what we're actually acting on, was that we're supposed to open 5 days on the Department of Education, and they didn't say that, the board.
In the order that came down from them stated that the 5 days. So that was in the order.
That's what I'm saying. He gave the order. The board there that gives him the orders on what he's supposed to dish out and tell people did not say that.
Oh.
That makes sense?
Yeah, no, I hear what you're saying. I have not heard that. All I know is when we received, well, I will check into that. And the chancellor who works with him just actually, two of the chancellors just spoke on that this past Friday, and absolutely were spewing the same words, that yes, we do have to do that. So I will.
I'll forward it over to you.
Question I don't know. Sorry?
I'll forward that over to you.
Please, thank
I
you.
was very surprised, and I waited the whole meeting going, oh my God, I can't believe I actually listened to this morning, and well, they didn't give him the authority to do that. That would be like
Yeah.
our superintendent taking action away from the board decision. And that's why I'm questioning, and I figured you may or may not have the answer. But I figured you would get the answer if you didn't have it.
You're talking about our board, or because it's not up to us as a board.
Right,
It is the directive of the superintendent.
right. What I'm
based
saying
on-
is orders from the school board to take action on certain things. Commissioner Cochran didn't take his orders from the commissioners of education up in Tallahassee.
Yeah, please send that to me.
Okay,
Thank you.
Thank for your report and welcome to this committee.
Thanks.
And with that, I guess Kelly, you're up next.
Okay, good. So I did present to the, Dr. Desamore, myself, and Sarah from my office did a presentation to the board today to kind of fill them in on things. So I'm just going to touch on pieces of that. And then if you want to watch the full meeting, you're welcome to do so. It's on YouTube. First of all, I think everybody knows by this time the governor did sign the budget finally. So it did go through as the way that he signed it. It had little to no effect on our FEFP. That's the way we get our funding. That's the Florida Education Finance Program. The things that were in there did pass. The 47.5 base salary for teachers did pass. It went through. The Family Empowerment Scholarship was increased. They had a cap last year from $18,000 to $29,000. And just so everybody's aware, there's two scholarships that affect Lee County. The first one that we've had for a while is McKay. So that is a scholarship that allows our ESE students and our students with 504 plans to attend private schools and receive a voucher from the state in order to help offset the cost of tuition. Now they have a new one, the Family Empowerment Scholarship, which is basically takes that ESE or 504 standing away, and it's basically based on the income of the family. So it's the lower income to help them have the ability to attend a private school if they would like. So that has a cap was raised on that one. We do believe it will affect Lee County. We had somewhere between 200 to 300 kids this past year that were in the Family Empowerment Scholarship. And of course, what happens there is that funding then is given to them instead of to us. The majority of those students were students that were not Lee County students that were in our traditional brick and mortar. They were already in private schools, and this was just helping to offset their cost of that. However, that is a lot of extra work for us because now we have to enroll them. We have to do all of the legwork in order for them to get it. But we got through it. We'll get through it again, but we do believe that's going to increase. So that was an additional amount of money that we had to set aside in our budget for those scholarships. The state made no changes to student projections. They also pointed out that they would, if we turned in our CARES Act plan and it was approved, that they would hold us harmless on student losses. We'll see how that happens. But I do want to say that with all of that being said, the budget as it stands right now, we are 99% sure will change come November, December after the elections. And when the additional revenues are starting to come in or what not is coming in, we believe for sure that we will see some more losses after November. So we're also trying to make sure that we have funding available to offset those losses so that we don't have to affect the way that we're educating the kids as we're moving forward. So I'm sure you all know the governor, when he signed the bill, he vetoed $1 billion worth of items in that. One of the items, and this is the one main thing that affected Lee County, was the school recognition and lottery. And that was the dollars that the schools received in order to provide those bonuses to staff members for any school who had received an A, increased by a letter grade or 2 letter grades and then maintained those letter grades in the following years, that they got money for that. Then the lottery money also went to some of our, not to some, but to all of our SAC committees if there was anything left to help move their school improvement plans forward. Now, our schools do have money in their school improvement plans right now to kind of help them over this slump in case, you know, they don't get it coming forward. There were a couple of other things that that weren't directly in our budget but do affect us, and one of the things was a grant that's done. It is the Administrator's Professional Development Grant. We pay for some of our training for administrators, some supplies, and some additional travel out of that, and we are looking for that those items to possibly a portion of those be picked up through our Title II dollars in order to continue that for training that was done. And one of the questions we had from a board member before had to do with the Guardian program and why we don't have the Guardian program. One of the things that was in the vetoes was the $41 million, it was million, $41 million that had been in the Guardian program that was not used last year. They were going to roll that over to be used in the program next year for FY21. That was taken away. That was one of the items that was vetoed, so that the extra money for that is gone. So while our budget right now, it looks like it was pretty much untouched. Like I said, we do believe based on the revenues and the shortfalls that we can expect to see, that we are definitely going to have some additional reductions, because as it stands right now, we don't believe that the state contingency funds or the funds that they had extra are enough to continue and cover all of the needs for the state. So we do believe we are going to see a loss. That being said, we did receive also our preliminary tax roll, which was good. It was up about $910 billion. So that was a good thing for us as far as our discretionary millages and our capital outlay millage goes. We will see a $653,000 increase in our discretionary millage taxes that we'll get, and about 1.3 million more in our capital outlay. Now, required local effort millage, we're not going to probably see any increase whatsoever, because usually what happens, and I think we've had this discussion before, when the tax roll goes up, they reduce our required local effort millage so that we do not generate any additional dollars from that millage. So we don't think that we'll see anything else from that one. We also discussed the different CARES Act, so I'm just going to fill you in, because the last meeting we also talked about CARES Act in detail. Some of the changes, though, that have taken place between our last meeting and now is some of the first indications we got on the CARES Act was that we could use that to fill the gaps in where our funding wasn't going to, where we're going to lose funding. They have come back and they have said that we cannot do that. We cannot put anything that we currently have been doing into the CARES Act because we can't prove a loss of revenue. So once we can prove a loss of revenue, then we can do that. So come November, we'll see. We may have to redo our plan. The plan is due this week. So they moved that from June 30th to July 15th, because on June 30th is when they told us that we could not do that. So now we're looking at today and this week it's due. So we're going to get it in, and we have built in some areas in there to help students and, with mental health, and to help with some additional supports in the schools that we really think kids are going to need at this time. Any questions so far? Nope. Okay. So sales tax, I know you all asked, go ahead, Daryl.
We did see, even with everyone being at home, we did see some funds come in from the sales tax. I believe you said 910 million.
So that was not sales tax. That was the property appraiser. The property in Lee County was appraised higher than they had initially estimated it would be. And that was what I was speaking about, was the property taxes. So that's
we the sales tax.
The sales tax is what I'm about to talk about now. And, you know, we did some revised estimates on sales tax because we assumed, and good assumptions it was, that, you know, when people are at home, they're not going to be out buying things. And so, of course, that's where your sales tax are driven off of. We were right in that the sales tax collections, as we had originally projected, went down. We're happy to say, though, based on our revised projections, the numbers came in even a little better than our revised projections for this current year. So that was good. And if you wanted to look at the PowerPoint presentation from today, there's actually a slide in there that shows that. I was trying to get it up so I could show it right now, but I didn't get it in time before we started this. But we have done about $2 million more than we had our revised projection over this last time period. We still have July and August that we're waiting to see because those collections are made in the previous year, so we will accrue them back. So we're waiting to see what they look like. We're hoping that they continue to be better than we had originally projected, as well as moving forward. We are, however, keeping our FY21 and on projections down below where we had been before because we really don't know what's going to happen at this point. And our thought process, it's easier to add things when the money comes in than to try and figure out what we're not going to do. So we're still moving forward with that philosophy. We're watching these numbers as they come in and looking throughout the year to see if we need to do some revised estimates on sales tax. Any questions on sales tax? Okay. Some other things I just want to point out, you know, there are additional costs, and some of them we've talked about. We have the, you know, personal protection stuff that we have to do for students and staff, face masks, hand sanitizers, things like that. That's all an additional cost. We're trying to look at all ways, and I think I mentioned this the last time, that we're trying to look at all sources of funding to see the best source of funding to use for the different pieces. So we have like the personal protection things. FEMA will reimburse us for some of that cost. So rather than put that, they will do that if we don't put it in our CARES Act. So we did not put any of that into our CARES Act. And we're opening well, we have already started with FEMA in order to try and get some reimbursements for our personal protection stuff. Of course, we want to try and get every source of funding to help our kids that we can. And so that's why we're doing that. But as we move forward, there's some things that we know even in the out years and in the current years that we're going to have to be thinking about. That cost of health insurance continues to climb. So we're going to have to, you know, kind of get a handle on what we're going to do with that. We were told the other day that, you know, I think one of the things, as I mentioned before, is our retirement rate this year went way up. I think it was a 10% increase over the previous year, which is a large amount of money. I think it was like $7 million for us. We have been informed that it will continue into next year to go up. So we don't believe that that will be a reduction that we'll see next year. We do believe there'll be another increase coming. And of course, we have to go through salary negotiations and things like that as we move forward through this year. Trying to see what else was on there that you might be interested in. Our capital budget, we pretty much have that set right now. We've been working with operations and academic services to work on our capital budget. We think we pretty much have it set. And again, in that presentation that we did today, the backup material in that presentation has our capital plan. It has the breakout of all of the different things that we're looking at funding. It does not have it broken out by school at this point, but it does have the major categories with the items that fall underneath those categories. So really that's the update that I have on the budget as of right now. We will be, hopefully tomorrow, we'll see tomorrow, but before Monday, I'm supposed to get the second calculation from the state. We'll see if they're on time. Hopefully they are, because I have to advertise by Friday. the new budget, and then we have a tentative budget hearing with the board on the 28th. Will be our first actual hearing with the board. So hopefully I will get that information on time, hopefully by tomorrow or Friday at the latest, so that I can get my information together for the ad and for the board at that time. I see Alina has a question.
Yes.
Yes, I have a question from my school actually. So they're wondering that if they will be able to provide hand sanitizers and masks for students who want to have them but can't afford to buy those items. And also they were wondering if the screens for reception area will be installed, and if yes, how that's going to be funded.
So yes, we are purchasing masks for every student and every staff member. There will be hand sanitizer provided to the schools, and we have a set amount that we're providing to them, and they can always purchase more if they want, but the district is providing a certain amount to them. So we are providing that for all students and staff to try and keep everyone as safe as they can. They are looking at putting those dividers, those plastic dividers up in the main areas, like in the office and areas where there's contact with the public. So we are looking into doing that as well. And right now that's all from the general fund, all looking to be reimbursed from FEMA, or portions from FEMA. I think Paul had a question.
I have a question on that line as well. Did you have
Okay.
something, Paul?
Yes, I had a couple for you, Kelly. Have we spoken with any consultants relating to where they see healthcare costs going? I mean, with COVID, who knows what direction they're going to go. We know they're going to go up, but we don't know how much exponentially they can go up with current costs that the insurance companies are feeling right now.
I have not personally, because that's not my area of expertise, but I am sure that Ms. McFarland has been in contact and looking to see what's happening, nationally and locally with cost, as well as our own cost, what's happening within our own cost at this point for that.
Okay. And how is the school construction moving along on the new projects? And has COVID thrown any monkey wrenches into guidelines that we now have to face with those construction?
As of right now, there's not been any additional guidelines put on from COVID. And as a matter of fact, we've kind of been able to move some things quicker along because of that. So it is coming along quite well, and it's ahead of schedule. And so we're hoping that we can continue that way.
Okay. And my last one, my favorite subject, the audit. Has the state given us any leeway in moving forward? Because obviously an audit approach that was put in place pre-COVID is going to be very different post-COVID.
When you say the audit, you mean just our regular yearly
The
audit?
internal audit that we were mandated by the state to do, we brought in an internal audit firm.
No, there's no change on that. The only change that has come from that is there was, I don't know if you all realized, but we had an audit finding. They said that we had to hire an individual versus the firm. That has been reversed. They now said the firm is okay to hire. So no, there's not been any change in legislation or anything that requires us to have that internal audit function done in our district.
So we still have to have the internal audits performed. However, scope I would believe needs to be readdressed because of COVID. Some of the steps, as I told this committee, I'm very active with the Institute of Internal Auditors. Every internal audit department is revisiting their audit plans and audit scopes. And I think that's something we need to make sure we address with our internal audit firm also, to make sure they are covering the new COVID factors. Some of the controls that we had in place before no longer exist because of virtual learning, remote engagement amongst employees, et cetera, changes the whole landscape versus working within a brick and mortar environment.
Okay. I'm not sure how that really changes. Mrs. Jordan, did you have a question?
I think that, well, it sounds like we're talking about two different auditors. I know the board has a internal auditor that we were mandated that we had to have. And that's what I just thought Ms. Lecture was speaking on, because at one point they said they had to be an employee, and then it was, no, you could actually get an outside team to work for you. So then the ruling came back down that it was okay, it did not have to be an individual, it could be a firm. So now we went back and we now have a firm, which is the board, who works directly for the board. And then we give them things to do. So whatever we believe that they need to be auditing at that particular time, we give them a list of what is the most precedent, and then they work the list. So right now they're on construction.
Okay,
Is that
and
the
then
one
that is what I was,
speaking of?
that is what I was referring to. And at previous meetings, we've discussed it back and forth between staff, because obviously they have to be available for the internal auditors, as well as Chris Petricka, who was our prior liaison. She was at those meetings as well, when we were discussing that scope and the approach that they were going to take to make sure there's as little impact on staff, especially in these very trying times.
Well, right, but they, so we've kind of like brought them, narrowed it down. So they're finishing their project now, which is in construction, and they have no problems with working with staff, because that was an issue with me too. It's like, how are you charging? How are we being charged for, your scope of work? What are your hours? If you're not able to get in touch with one of the staff members. But with everything that's been going on, there has been no problems. It's been smooth, and all the information that they need, because now they're sending us updates very often, because we make sure that now this is who you are, you're working for us, you need to be sending us the updates. But as it stands right now, there is no problems with, as we look at what's going on with construction, everything is going well. And then once they've completed that, then we'll give them another job, if you will, depending on what we look as, or what we deem to be important to the district.
Okay, thank you.
Mm-hmm.
Kelly, you stated that the district was trying to buy large purchases of masks and supplies for the students and staff.
Mhm.
CDC stating that you have to either clean them or replace them every 4 hours approximately. Are we accounting for multiple masks per day per person, or is that just one mask per person over the school year, or how is, I'm just trying to understand this.
I'm not exactly sure. I believe we've discussed all different ways. So we've discussed buying a mask, and then people having to clean their mask and things like that. But I'm not sure what they finally came down to. Dr. Desmore has been working on that with procurement in order to make sure that we have what is needed. So I would have to get that information and bring that back as to exactly what it is that they're looking at providing.
Because I think also that they were talking about giving X amount out per student and per employee if you did not have that. If you look at the other districts within the state of Florida, because I've been watching all those as well, they're pretty much giving you 5 masks, cloth ones for you to, and teaching you how to wash them and maintain them. But of course, if a child comes into the school, we are to have that available for that child. So I don't know how, and that's another thing, is like, how do we know what that costs? It's going to be very hard for us to calculate that. So they're trying to work miracles in keeping track of what everything is going to be costing us.
I agree. Thank you. I wanted to ask the question because, like Debbie just said, it doesn't make a lot of sense. It's hard to quantify how much this could actually cost, and will we have enough, and what happens if we hand out 5 per student and, you know, little Johnny comes in today and his is all ripped up hanging off of him? Are you going to tell him you can't come to school because it's ripped up and hanging off of you? Just about.
Right, and I will also like share with you too, because I had questioned today earlier, we had a recall on product. So they're coming back to take all that, this hand sanitizer, which was poison or whatever it had in there, removing all of that. And then we have to make sure that we have enough supplies on hand that when these recalls come in and we have to remove them, that we have something adequate to replace them. So there is a lot that every one of, you know, our team is really, you know, working hard to make this a reality. I mean, I don't know how as I said, every day is a new day, every hour, you know, it changes.
Mm-hmm. And you know, what makes it really tough is we still don't know how many kids are actually going to show up for brick or mortar, how many are going to do Lead Connect. So it really is, you know, just kind of, you know, I think Ms. Jordan, we were talking about this earlier, like a crystal ball. You kind of like, I wish we had that crystal ball that we could figure it all out, because we just don't know. And our approach is I would rather have more than I need than not enough. So that's what we're looking at. We, you know, are going to get everything we can that we, you know, we're going to need in there. And hopefully we've done that. If not, we'll order more. But, you know, I know that we'll have enough at least to start the school, and then we'll see what happens. Because, you know, even throughout, you know, we're giving options when they do Lee Home Connect to come back later. So that means we'll probably have to be buying more as those decisions are made to come back into the school setting as well. So it's a moving target, and we're going to do our very best to keep moving with that target. And I think at today's meeting, the word that was used was agile, that we're going to have to be agile, and that is what we're definitely going to have to be and try to do as we move forward. We just don't want to miss anything, because we want everybody to be safe. Mr. Cohen did send me a question about students with special needs and the safety of those students. So again, we're at the same spot with this right now. We're doing everything we can to make sure that we provide that safe environment for those students. We provide the same types of resources that we did before, plus these others. I'm not sure how many of our special needs kids will actually be coming to school face to face, you know, and that was some of the concerns that we have too. If you have a child that has some kind of a breathing problem, you're more than likely not going to send them to the brick and mortar school, but I don't know that. So we are right now assuming full classes, and then we'll see how it plays out when they get here or don't come. We'll have to figure that out at the time. I hope that answers your question, Mr. Cohen.
It did, Kelly. The concern I guess I had is I know we received some funding also to assist with that. And obviously if less students arrive at the school, is giving that much less funding. But I don't know if we have contracts with certain companies to provide that support staff, and if we're locked into those contracts by a reduction of students that they're servicing, how we're handling that.
Yeah, so I just want to make it clear, just because the student doesn't come to the brick and mortar does not allow us to not serve that student's needs the way they have to. So we're doing what we can to serve those needs. Some of our consultants have now been doing things over Zoom over the summer with the students in order to make sure that we meet all of the individual education plans of the students. So we will continue to offer those services the best that we can, in any way that we can. With the funding, I think you're talking about the IDEA grant that we get. And I really don't see a loss in that, because we will still have those students in serving that population. Any other questions? I don't see any questions.
That was actually a really quick meeting then.
Yeah.
What do we need for the next meeting, Kelly?
I think Mr. Cohen had a question, actually. He just raised his hand. So,
Yes. Daryl, I had a couple of questions that if I could ask of Debbie. The one concern I did have was I saw Collier County, it looks like they pushed back by a week on their start date. They said it doesn't seem to potentially impact their calendar, but I have a feeling that we're gonna probably hear from the parents in Lee County asking the same question. And is the school board looking to see, do we really want to be the leader, or should we take a step back, working with staff and the superintendent and getting it started at a proper timeline?
Okay, I'm sorry, could you cut in and out? So are you asking, are we starting on August the 10th?
What, I don't know if that date has been cast in stone as of yet. I know Collier County pushed back by a week, and I didn't know how the school boards felt about Collier maybe waiting to see what Lee County does. And it's appearing from some of the things I see on Week News, we put out some information, and then suddenly it's fascinating how Collier County's following right behind us and putting the same process in.
Right. Well, and a lot of times that's what happens because we're like counterparts, I guess. We're neighbors. So a lot of times we do feed off of each other, as well as, we look at bigger districts like us, throughout the state of Florida. But even in today's meeting, it was going to be the 20th when we were going to decide what was going to take place. As it stands right now, based on my perception of what I took from the meeting today, we will not start on, I don't believe we're going to be starting on August 10th. I believe we will be moving back. And that's why Angela was saying earlier about the calendar committee meeting. So Monday is when that will be discussed, and then they have to look at the calendar. And it, of course, has to do with the teachers and the 216-day teacher or staff. So there's so much more involved in this. However, me personally, I would prefer that we wait. The numbers are supposed to be under 10. We're at like 21 right now. So I don't see how we can just open the doors and say, okay, it's not at 21%. So that's my own personal take on this.
And what appears to be the plan for athletics? Again, Collier.
Well, right now, I think, well, we haven't moved. I think we're still on phase 2 of the sports, as far as kids being out there and practicing. So that's being monitored by the district, as far as each school is monitoring those kids and the district itself. They're making sure that the kids are doing what they need to do and keeping them as they're not in the bubble like they are in Orlando, but they're trying to keep them with the same kids. So they're trying to keep them as safe as possible. And same with the waivers. Today we heard that the waivers will not be put out to the teachers.
Going back to athletics, and this is my last question. If a student's parents opt to have them educated virtually, but the student is an athlete,
yes,
how are we going to handle that? Because now we have somebody who's kind of walking that fine line between how do I want to be educated, but I'm not that afraid of COVID that I'm not afraid to be out of practice.
Okay, if you as a homeschooler at Lee Home Connect or Lee Virtual, you are permitted to play sports at your school. The Lee Home Connect will be connected the student with the home school. So say if you are at Fort Myers High, so you would have that connection at Fort Myers High with Lee Home Connect, and you may play sports there. Like right now they can, Lee Virtual can play sports at different schools. They will be permitted to do so. However, the parent or guardian, someone would then have to provide the transportation to the facility for their practice. So yes, they will be able to be engaged with the different arts, and I believe the arts program is with that as well, as much as the sports.
And what about the athletic events or if we ever get to the stage, theatrical productions, would the parents need to transport again the child, or are we now providing busing services for those individuals?
Well, we have not gotten that far yet on that. I know that as far as the kids that are the virtual and homeschool going to practice would be, or are you speaking of it, they're going to a game on the bus? Okay, that has not even been discussed because we're not even at that level yet of, you know, are the kids actually going to be able to play once we got to get past all these other phases first. So that conversation hasn't happened with us. I know that for a fact.
Thank you.
So when it does happen, we'll definitely let you know on that.
John?
Thank you, Mr. Chair. Is there a way to protect our funding and respect public health decisions that we tie to certain numbers? So let's say that we need to be under 10%. So once our positivity rate falls below 10%, that we will do this phased approach into in-person learning. Once it falls below 5%, we'll enter this phase of in-person learning. And that way it's tied to scientific data that we can actually point to and say, this is where we are, this is where we need to be, and this is how we're going to approach this. Rather than hell or high water, we're going back to school August 10th or else you don't get money. It seems, and I don't know if this is a budgetary question or if it's a board question, a policy question.
So do you want me to try and take this first, Ms. Jordan?
Yeah, that's fine, Kelly. Thanks.
Okay, so while I hear what you're saying, I don't think that the board has that discretion when it comes to the money. We've been told that by August 31st, we must open schools 5 days a week. We don't have a choice. We don't have, and that is in order to receive funding. If we do not open the schools by August 31st and have an offering of a 5-day traditional brick and mortar school for students who want it, then we do not get paid. So it is not a decision the board can make. They can push it to August 31st. That's the latest they can push it to at this point. And that was part of what came down from the state. So our option is to postpone it to that day, but beyond that, we don't, as a district at this point, have anything to do but offer what we're told we have to offer. So that's why the district has chosen to offer many options to our parents so that they can make their choice for their student, whether they want the brick and mortar that we're being forced to open in, or they can do the Home Connect, which offers that same kind of learning environment, but online, or virtual learning for those other students that, you know, are more go-getters on their own and things like that.